Hello everyone, my name is Faris and today I'm going to start uh, our group presentation on building an inclusive digital economy in Malaysia with a focus of using Doctor on Call as our local case study. So let's start with the introduction. So the digital economy refers to the economic activities that are driven by digital technologies such as artificial intelligence, AI, cloud computing, e-commerce, payments like e-wallet and stuff, and online platforms like social media. So these technologies have transformed the way people communicate, connect, access service, and also conduct business. So in Malaysia, the digital economy is becoming a very important driver of our economic growth, with government initiative such as My Digital supporting the country's digital transformation. However, digital growth should not only focus on technology, because we should also ensure that everyone can benefit from these opportunities, because this is where the concept of an inclusive digital economy becomes important. So an inclusive digital economy means all the individuals and businesses have equal access towards the digital technologies, regardless of their income, age, location or background. So the goal here is to reduce the digital divide and secure that no one is left behind and be able to access all of the accessing technologies. So in the healthcare sector, like Doctor On Call, inclusivity allows more Malaysians to access online medical consultations, digital pharmacy services, and reliable health information through platforms such as Doctor On Call. So this is especially beneficial for rural communities, B40 households, older persons, and persons with disabilities who may face difficulties accessing traditional healthcare services. So uh, overall, the main goals of inclusivity are to improve the digital accessibility, enhance digital literacy, support local businesses, and also provide the secure digital services. So by achieving these goals, Malaysia can really build a sustainable country and sustainable digital economy that improves the quality of life of all citizens.
Hello everyone, and my part is Malaysia digital transformation. And the current landscape is rapid digital development driven by national initiative and increasing adoption across vital sectors. The National Growth Initiative include Jendela, which improve national digital infrastructure and connectivity, ensuring quality broadband coverage for all, especially in the underserved area, and My Digital, transforming Malaysia into a tech-driven high-income nation and region leader in the digital economy by 2030. The digital everyday digital adoption include advanced infrastructure, trade now QR payment, and e-commerce growth. Digital divide. Despite national success, significant disparity persists between urban and rural communities. The urban versus rural divide is urban area have 99.9% and the rural area have 90.7%. Rural communities face distinct disadvantage and in increasing essential digital service, particularly those requiring stable high-speed connection. Impact on digital health. Connectivity is more than convenience, it is a necessity for modern healthcare delivery. Healthcare access barrier. Digital healthcare platforms such as Doctor on Call rely heavily on highly high quality video consultants, real-time online pharmacy service, digital health information flow, limited internet access effectively exclude vulnerable population from those benefits. Key socio-economic barrier is digital literacy. Lack of computer skills and technical confidence prevent older generation and low-income family from navigating digital platform. Affordability, hardware cost, and data plan remain a significant hurdle, limiting access for households with limited disposable income. Building inclusive economy can strengthen rural infrastructure, accelerate fiber and 5G development to rural zone. Digital literacy training, implement community-based workshop for underserved demographic, support health tech SMEs, provide grant and incentive to.
For Malaysia to achieve better digital healthcare, there are several important strategies. First, the government should improve internet coverage through MyDigital and Jendela, especially in rural areas. Good internet allows more people to use online healthcare service. Second, the government should support local digital healthcare companies by giving digital grants, tax relief, and innovation funding. This can help companies create better healthcare service. The government should also improve law on telemedicine, cybersecurity, and personal data protection. Strong regulation will help people trust digital healthcare service. Besides that, stakeholders need to work together. This include the Ministry of Health, MDEC, healthcare providers, telecommunication companies, universities, and technology companies. When everyone works together, Malaysia can provide safer, better, and more accessible digital healthcare for all citizens. Now next looks at two case studies. The first example is Dr. Onco, a Malaysian digital healthcare company. It provides online consultations through video, voice, and chat. It also offers e-pharmacy medicine delivery, health screening, and vaccination service. During the COVID-19 pandemic, Dr. Uncle helped many people receive medical advice and medicine without leaving home. This shows how digital healthcare can improve convenience and assist. The second example is Teladoc Health, a global digital healthcare company. It provides virtual healthcare, mental health support, and chronic disease management. It also uses AI to improve patient care and patient engagement. Malaysia can learn from Teladoc by expanding telemedicine service, supporting responsible AI, and encouraging cooperation between the government, healthcare providers, and local companies. However, Malaysia should not copy other countries directly. Instead, we should adapt this idea to meet Malaysian own needs and build a better digital healthcare system by 2036.
My name is Junjie. Today I want to share our vision for more inclusive digital healthcare future in Malaysia over the next 10 years. We aim to build a digital healthcare ecosystem that improves access for all Malaysians while empowering local business. We'll achieve this by building extinct initiatives like MyDigital and Jendela. Our first vision is to expand digital healthcare nationwide. Many rural communities still face barriers like poor internet and low digital literacy. Platforms like Dr. On Call can help Malaysians access online consultation and medic delivery to anywhere. We'll also support the elderly and less tech-savvy users through community digital help centers, so no one is left behind. Our second vision is to empower local digital healthcare business. Companies like Dr. On Call have shown we have the talent. By 2035, we want to provide grants and tax incentives to encourage innovation. Through partnerships with MDEC, universities, and tech companies, we can develop AI and remote monitoring. We will create high-skilled jobs and help Malaysia become a regional digital economy leaders. Our third vision is to build a smart, secure, and inclusive healthcare system. Protecting patient data is essential. We will strengthen electronic health records, promote responsible AI, and implement stronger cybersecurity. With proper concerns, providers can share information securely, reducing duplicate tests and improving care. Nationwide digital literacy programs will help citizens to use this service confidently. In conclusion, by balancing innovation with security and trust, Malaysia can lead the region in digital healthcare while making sure no citizen is left behind. Thank you.
Next, I'll present the challenges, possible solutions, and the conclusion. One of the biggest challenges in Malaysia's digital healthcare sector is the lack of high-speed internet and digital infrastructure in rural and remote areas. Although platforms like Doctor On Call make healthcare more accessible, many rural communities still struggle to use these services because of poor internet connectivity. To overcome this challenge, the Malaysian government should continue expanding the broadband infrastructure and provide affordable internet packages for B40 households. Public digital health kiosks with internet access can also be established in rural clinics so that everyone has equal access to digital healthcare services. Another challenge is securing sufficient funding for digital healthcare companies. Businesses such as Doctor On Call need continuous investment from the government to improve their technology and expand their services across Malaysia. The government can support these companies by providing research grants, funding, and tax incentives. This will encourage collaboration between hospitals, universities, and technology companies while keeping healthcare services affordable and accessible. In addition, many elderly citizens and low-income groups are very unfamiliar with digital healthcare applications. As a result, they continue to rely on traditional healthcare services. To address this issue, the government should organize digital literacy programs, develop user-friendly and multilingual healthcare applications, and encourage doctors to educate patients on how to use telemedicine safely. In conclusion, Malaysia's digital economy has great potential to improve healthcare accessibility, encourage innovation, and strengthen the country's economy. By investing in broadband infrastructure, supporting digital healthcare innovation, and improving digital literacy, Malaysia can build a healthcare system that is efficient, affordable, and accessible for everyone.